A healthy mouth, a healthier you. Saving lives through the early detection of oral cancer. The statistics are alarming. Each year in the United States, 30,000 people are diagnosed with oral cancer, and 8,000 people die from it. That means this little-known disease kills one person every hour of every day. In fact, oral cancer takes more lives each year than cervical cancer, Hodgkin's disease, or cancer of the brain, liver, kidney, or skin. Dr. Jed Jacobson talks about one of the reasons why this disease is so deadly.
Unfortunately, most people aren't aware of oral cancer or its signs and symptoms. As a result, more than half of all cases aren't diagnosed until they're at an advanced stage. And even then, the cancer can masquerade as a harmless-looking lesion.
The most common symptoms of oral cancer are a red or white spot in the mouth or a sore that won't heal. Other signs include a lump or thickening of the cheek, an unexplained and persistent sore throat, difficulty chewing, swallowing, or moving the jaw or tongue, and numbness or swelling in the mouth.
The good news is that oral cancer can be prevented by understanding the symptoms and by making healthy lifestyle choices. If you don't smoke, don't chew tobacco, and drink only in moderation, you can significantly reduce your risk of getting oral cancer. Regular visits to the dentist are also key.
During a typical dental exam, your dentist routinely looks for signs of oral cancer. For example, if your dentist finds a red or white spot that can't be explained, a painless diagnostic test called a brush test can be used to detect abnormal cells before they turn into cancer. This is how it works. Your dentist takes a small tool that looks like a tiny bottle brush and rubs it on the suspicious area to collect cells. The cells are then transferred to a slide and sent to a lab for analysis. Most of the time the results are normal, but if they aren't, your dentist can follow up with a biopsy for a definitive diagnosis. In less than a decade, the brush test has helped save thousands of lives, not to mention hundreds of thousands of dollars in healthcare costs. In fact, in 2004, after finding out about its considerable life-saving potential, Delta Dental became one of the first benefit carriers to offer coverage of the brush test.
Right now, the 5-year oral cancer survival rate is only 50%, and it hasn't changed in 40 years. That's why we have to use every tool in our arsenal, including the brush test, to stop this deadly disease in its tracks.
You can do your part by understanding the signs and symptoms of oral cancer, making healthy lifestyle choices, and seeing your dentist on a regular basis.
When oral cancer is discovered early, the survival rate climbs to over 80%. That's why it's so important for patients and dentists to work together. If they do, no one may ever have to die from oral cancer again.
A healthy mouth, a healthier you is brought to you by Delta Dental.